the question today is, how do I decide whether I want an epidural or to go without medication during birth? And depending on what you decide, both options are correct. So whatever you decide with yourself and your caregiver is always going to be the best option. But deciding on an epidural is a completely personal experience. The main thing I like to offer when women are pondering the choice is that labor is a completely natural process that our bodies know how to do. So there are chemical hormones released into the bloodstream during labor that actually help us to manage pain. Childbirth is an intense process, but it doesn't have to be medicated to be manageable. If that's something you want, it's definitely an option that is just as good, because anything that feels right to you for your birth is going to be the right option for your unique experience. Here's a little info on both. So medications can range from intravenous drugs like narcotics all the way up to epidurals, which can, if given at a specific time, numb the body and help you to not experience pretty much any feeling. So a little bit about IV medication. It can be given at a very specific time in labor. So if it's given a little too late and too close to delivery, that can go through the blood barrier into the placenta, and it can cause some things like breathing issues, other complications for a baby. But there are a lot of women that get these IV drugs and do not have complications for their children after birth. And then epidurals, they will numb the whole lower body, and this can be very, very effective of not having any pain or feeling sometimes at all. You could feel some pressure. I've heard women express it as a pressure, but the epidural is something that's given generally before transition in labor, so it is administered directly into the spinal fluid. And some things to consider here are that it will limit your movement and your ability to feel contractions. So be aware of what's going on in the body. To be aware of that, they will hook you up to a monitor so that they can time your contractions and sort of decide when for you to push. So you'll actually be told when to push rather than naturally feel that urge and have your body tell you when to push. So it also makes certain laboring positions a little improbable and increases the time that you are hanging out in the hospital bed. So the beauty of childbirth transcends both options. You can have a lovely epidural birth, but natural birth is something we have been doing for the duration of humanity, and we are built for it. So with natural birth, your body will contract and you will feel it. This is your body telling you each time that you are one contraction closer to meeting your baby. So your whole system creates hormones that actually dominate the hormones that ring the alarm bells of pain in the body. That doesn't mean your birth won't include pain, but for many women, natural birth is described as an intensity rather than a painful experience, because those wonderful oxytocin, serotonin, and many more hormone secretions hit the brain first, and they actually help us to push those feelings of pain and fear out and allow for a calm and centered approach to medication-free birth. At the end of the day, though, any choice you make, again, will be honored in your birth, and you are always in control.